I would like to demonstrate what is my favorite technique for stretching the piriformis and other deep lateral rotation musculature of the pelvis. And the reason I like this technique so much is it does not involve using the leg, the lower leg, to create a rotation of the thigh at the hip joint. Because when we use the leg to rotate the thigh at the hip joint, we end up placing a torque through the knee. And if the client has an unhealthy knee, we really want to avoid that. And even if the client has a healthy knee, we might make it unhealthy by torquing the knee joint to perform the piriformis stretch with that lateral medial rotation of the thigh at the hip. So instead, what we're going to do is work with a movement that is horizontal adduction, horizontal adduction. And we're going to be working contralaterally, opposite side. So we have our client, Anya. She's lying supine on the table. I have her scooted closer toward me so I don't have to reach way over the table. I'm on her left side. I'm going to be stretching her right side. We have her hands with her fingers interlaced a bit higher up on her abdomen here, so they're not going to get in the way of the movement. I'm going to flex her hip and knee joint and bring her thigh vertical. So we have her thigh at the hip joint at about 90 degrees. Now, for context here, I'm standing on her left side faced across the table. My right shoulder is closer to her head. That is the cephalad shoulder. Cephalad means head. My left shoulder is closer to the tail of her body. It is the caudal shoulder. So I'm going to be using my right armpit axillary region here, the cephalad side, to go around her knee area here. And I'm going to wrap around this way here. And I am trapping her distal thigh, knee, proximal leg in my axillary region, the armpit, cephalad side. I'm going to get myself in a comfortable position. My left hand will go on the table. I don't like having this position for my wrist joint because it puts my wrist joint at 90 degrees of extension, and that's uncomfortable for me, so I prefer a fist. My other hand, my right hand, will find the table down here, and I'll have a nice fist contact there. Make sure she's hooked in there. My right thigh, my left thigh are against the table. My right foot, my left foot are down on the floor. I have 6 points of stability now. 2 hands, 2 feet, both of my thighs. Now, all I need to do, given that now the piriformis is lined up vertically along here from the sacrum to the greater trochanter, the piriformis in this position can do horizontal abduction, so it will be stretched with horizontal adduction. And that's what we're going to do here to perform the stretch. I start here, and all I need to do is use body weight to simply drop down. I bring the thigh over into horizontal adduction. Now, the angle we drop is extremely important. If I drop too horizontally away, then the pelvis leaves the table and the stretch leaves the pelvis and goes up into the lumbar spine. If I'm trying to rotate and stretch her lumbar spine, that's great. But our objective here is the piriformis and other deep lateral rotation musculature. So as I drop toward the left side of the table, I need to drop down to keep the pelvis on the table. And this will put a very nice stretch into the piriformis here. Now, a few things about this technique. When horizontal adduction is used to stretch the piriformis, we are compressing the hip flexor inguinal ligament region here. If someone has a very tight hip flexor muscle, whether it's TFL or sartorius or all the way over the adductor longus, then that tight, hard musculature will be compressed against itself in effect, and that can create a pinching pain. When that happens, what I can do with this technique is I don't really need my hands on the table. I still have both my feet and both my thighs stable, and I can be free with my hands. I can come in here and find the tightness, and 100% of the time the client can point out where it is. But also you should be able to go in and feel where the tautness, the tightness is. Then I will reinforce my finger pads, and what I'm going to do is I'm going to traction, open up this area by leaning back, and I want to kind of exaggerate this. I lean back on the left side of my body to create this opening up. But then what I do is I come around to the right and down. So it's like a scoop movement here, down and around. So I get the opening up here and I come around. And that's the way I could open this up. And a good 90–95% of the time, perhaps 100% of the time, we can get rid of that pinching pain. I'd stated that pinching pain was tight, taut, hip flexor myofascial tissue. It could also be a compressed hip joint, and that also can create a traction when we pull with reinforced fingers to open up that hip joint and prevent there being compression in there. Now the next thing is, if I'm performing this technique, if I am a female therapist, especially if I'm large-breasted, then my breast tissue would be contacting their thigh. Also, we do have the knee joint in quite a bit of compression. So there are two reasons why we might want to modify our position relative to the client. So what I'm going to do, and I always make sure I explain to the client what I'm doing and get verbal consent before, is, Anya, I'm going to come around here and bring your lower leg around the back side of my body here, okay? So now what I've done is my breast tissue, if I'm a female therapist, is farther away from them, less likely to contact them. The knee joint is no longer in flexion, full flexion compression, and now when I drop down with body weight, I'm right on her thigh and I'm eliminating the knee joint entirely. And in fact, in this position, her leg, her lower leg, is actually resting on my back, so it's supported. So this position here is actually a very efficient and powerful position to use to create this stretch. Now one more thing, whether it's the standard position or this position, I show it as a default coming across here. But if I were to angle more toward her shoulder, the stretch will move a little more in this line down this way. If I come straight across, the stretch is here. If I were to angle down more inferiorly, the stretch moves up. So we have a choice of the direct angle, the direction of the angle that we use here, whether it's straight, pure horizontal adduction, a little bit more vertical, a little more vertical, a little more vertical. We can change the angle until we find that we're catching the tight tissue. And that's something we can feel because it's like we're a detective, a sleuth, looking for tight, taut tissue. And when we find that, that's where we want to effect the stretch. Also, if the client has been complaining, experiencing pain, discomfort here, if we can move it around and they can say, that's it. That's what I've been feeling. That's where the tightness is. That to me is the golden platinum rule for where you want to do the stretch, because not only are you stretching and treating what needs to be stretched, you're stretching and treating what the client is experiencing and they're coming in for. So this is a very effective technique. It's performed with horizontal adduction. It's performed contralaterally, opposite side. I'm on the left side, stretching her right side with the client supine. A very powerful, effective technique for stretching the piriformis and other deep lateral rotation musculature.